We talked a lot about DBS, but there's the other one, the MR-focused ultrasound. I'm going to try and save your voice. But can you explain what that is? And is that a better, different option than a DBS, or can they be done one after the other?
No, it's a wonderful technology. So, when I talk to patients about MRI-guided focused ultrasound, it's a good procedure for Parkinson's, for tremor, better than dyskinesia. It does work better for tremor than dyskinesia, and right now it's just for unilateral, meaning on one side of the body. So if the patient has symptoms on both sides significant, we're only really going to get relief on one side of the body. Right now it's not FDA approved to have focused ultrasound done on both sides, so we only get one side of symptom control. It works better for tremor than dyskinesia. It is incisionless, and so it does not require I shouldn't say general anesthesia, but it doesn't require any anesthesia necessarily, and no cuts are made. It's done through just shaving the hair, ultrasound gel. There is a halo installed, but the ultrasound beam is applied, and they're able to perform tremor surgery through a sound wave entering the skull and disconnect the tremor circuit in a way to control symptoms. And it's generally instantaneous, although there can be a building effect, but it's irreversible. I do look at this as causing a stroke, a very targeted, precisely targeted stroke to disconnect the tremor circuit, in a manner of speaking. So there's no hardware and no programming, and a more instantaneous result, but it's not titratable. I can't go up or down on the tremor control. What's done is done. And only one side of the body can be performed. So if we are talking and we think the deep brain stimulation makes more sense, there's more symptoms. If the patient may be more symptomatic on one side or have perhaps a contraindication or a reason, I should say, not to undergo deep brain stimulation, then focused ultrasound could be a reasonable substitute. On the other hand, many patients are not interested in having invasive brain surgery, even if it is minimally invasive. It's still having hardware in two separate surgeries. So this could be appealing to those that don't want to go to a more invasive approach for their tremor. The last thing I would say about focused ultrasound as well, data is still coming out about long-term outcomes. We do see that it's not as potent in the long run as deep brain stimulation for symptom control. Roughly speaking, the tremor circuit starts to regrow, and so it grows around that lesion that the neurosurgeon caused. And whereas with DBS, then you can just crank up the power of the electricity to compensate as that tremor gets more strong. You rarely, but it can be done, you can go back in for further ultrasound procedure, but it comes with increased risk of side effect. You asked, and I'll say one final thought. You can have MRI-guided focused ultrasound and then deep brain stimulation, but you cannot have deep brain stimulation and then MRI-guided focused ultrasound. That would be too much procedure on the brain, and the MRI can't be targeted with a wire present. And so there's an order that have to be done and obeyed. But generally speaking, DBS is more potent.